Our partners are the hospital, the hospitalists, and then the care coordination organization that I haven't mentioned yet, just based on not having that liberty to do so.
I can also say that on our telemed vendor, our number one requirement is any telemedicine activity must go back to the primary care physician for coordination of care.
How is it all apps, or is it all?
Well, it depends on what connectivity is available, but to the fact that if they have the automation available, it's automated. But there are probably some situations where it's a printout to paper and a mail to the office.
And I'll add to that as well. There are several systems around the country that actually are initiating their own virtual health programs. And when we can get more involved with those programs from the hospital and the physician system perspective, that's a much better, more timely way to connect the member with their medical record. So I have been encouraging the markets as I've been speaking to them about where their opportunities might exist to start asking the systems if they have those virtual health opportunities. They may only be using it for their employees, but if we can jump on that ship with them, we'd love to do that based on the immediate access to medical records.
Hi there. I'm Eric Weil. I'm with Partners Healthcare. I'm a general internist. And I just want to make two observations from the point of view of a practicing doctor on the ground. The infrastructure that you laid out for the way that your provision of primary care is spot on. It's fascinating, and it really addresses all of the different needs that are really in existence in the broader community. But primary care, as it's structured right now, isn't, and the physicians that provide that care aren't either in the mindset of delivering care in that way, or are not structured to do it. And I just think it's very important, as you change the paradigm, that you make sure that you have strategies in place to bring along the physicians with it and to address the way that they're delivering care. So if you're carving out a certain group of patients to be delivered by landmark, and you're moving out the healthy patients to the nurse practitioners, and you have care managers managing another piece, then the structure that will be left for the general internist or the family practitioner is going to be much smaller and much more complex. You're going to need to start recruiting a different type of primary care physician to fill those slots. And they're going to need to be trained different. They're going to need to be specialized in specific ways. And they're probably going to have to be expected to see fewer patients because of the level of complexity that they have in place. And so all I would say is that you have to make sure that you're not using the old paradigm for the physicians that you're recruiting and how you're compensating and incenting them in the new model. So that was number one. And then number two is the social determinants of health, which is, I agree, very, very important, especially in areas that are traditionally underserved. But the infrastructure of practices, again, are not well designed to manage that. Right. And as we're implementing this across Partners, our doctors are freaking out because the way that 5 years ago, when we asked them to start screening for depression, and suddenly they found out that their patients were depressed and they needed to do something with them and have some place to refer to. The same thing is going to occur now as you're screening for social determinants and you can't solve housing or you can't solve food. And so it's going to be very important to make sure that you have the right portfolio of resources, both funded and available, to make sure that that happens. So just two thoughts from the front line.
Thank you.
Excellent points.
Yeah.
And actually, that brings us to the end of the session. I'd like to again thank both Catherine and Mike for a very stimulating presentation and a great conversation with everyone.
Thank you all.
Thank you.
So at this time, we're going to take a brief 15-minute break in the foyer area. Please visit with your sponsors as you grab something to drink. And then following the break, our first exemplar case study of the day will begin promptly at 9:30. So enjoy your break, and please be sure to complete your electronic evaluations.